Hi everybody, Dr. D here. I put together a presentation on SOAP notes. I had mentioned to you earlier in the term that I wanted to introduce this topic to you, so you would have a bit of a advantage as you move forward in the program. When you get into your clinicals, the development of SOAP notes is so important. Um, Really, a great majority of your grade rests on the development of your SOAP notes. So it's very important to know how to create one that's relevant and is in a particular order that will help guide you. I use SOAP notes to this day. They actually help me identify the diagnosis and treatment plan. So it really works well. It's to your advantage to have a good eye on the development of these SOAP notes. So subjective, and it seems like a really simple term. However, I have found in all of my years of teaching that some people get just confused with subjective. When you're doing the patient interview, subjective is the first thing that you're going to do, and subjective is what the patient tells you. You start with the chief complaint, and the chief complaint really is one or two words that describes what brought the patient in to the clinic today. What made them decide I need to be seen? And here it says I'm having right-sided ear pain. I make it as simple as possible. I just put in there right-sided ear pain. Now we're going to expand on it when we get to the history of the present illness. Now, in some clinics, now this won't happen to you when you're in practicum because this will be your responsibility. But I was surprised in the new practice that I'm working with. The medical assistants do the chief complaint, the HPI, and the review of systems. I'm not used to that. I'm used to doing it myself. And so I go back and I look, and honestly, I have never had one medical assistant write a complete history of present illness. So I go in and I write provider note and I write my own because I have worked a lot in the medical legal aspect. And so I always go back to that. I want to ensure that my note has all of the components in it that will be there to protect me in the event a case ever went to court. So let's look at this history of present illness. AE is a 26-year-old Asian female. She presents to the ENT clinic with complaints of right-sided ear pain. Now you're going to see onset. What does that mean? The best way to develop a note is to have some method, right? Method to put it together. And a good way of doing that is by using a method called old carts. And old carts is the onset, location, duration, character, aggravating factors. Ooh, there's one, radiation is supposed to be on here. And time. And what's the other one? S. Severity there. Now I do it a little differently. I put it in an order, all right, so that it makes sense to me. And I'm gonna do that here for you, so that I think it will make a little bit more sense. All right. I'm gonna insert this little thing in here. And I do it in order only because that's how I learned how to do it. You're going to find that you do many things in school um, due to the way that you were taught how to do it. So hold on a second, and I'll be back in just a moment. Okay, so here's that sample I was going to show you. Old carts. Onset, location, duration, character, aggravating factors, relieving factors, timing, and severity. And for me, as a provider, I don't do this anymore, but what students will often do is actually write onset, location, duration, character, aggravating factors, relieving factors, timing, and severity in that HPI area to ensure that you're covering all of your bases. And I think in the beginning as a student, it's paramount that you do that to ensure that you are getting all of the points you should for your SOAP notes, because essentially, as I said, your clinical performance is really based on SOAP notes and then the evaluation from your preceptor. So work hard to ensure that they're documented appropriately. All right, so now next we're going to look at the pertinent negatives and positives. So the negatives, and this is meant to help us formulate a differential diagnosis. You'll also be getting a presentation today to help you understand differential diagnosis a little bit better. So the negatives: no fever, no chills, no infection, no travel, no ear trauma, no history of ear infections or dental infections, sharp pain, no pain that's caused from talking or smiling, no ear drainage, no tinnitus, no dizziness, toothaches, or headaches. Now, what are the pertinent positives? She reports unilateral dull and aching pain that radiates from her right ear to her right jaw, complains of jaw clicking and jaw pain. The symptoms are worse after clenching her teeth, and chewing also worsens the symptoms. So these are all clues. I always define our charting as the investigation. So this is our investigation. It's like a CSI investigation. We are formulating, or we are gathering all of the information to help formulate a diagnosis. And that is what the patient tells us and what we see and what we do with the examination and with any laboratory tests. All of those things help us formulate that diagnosis. Now, nothing's 100%. That's why we develop differential diagnosis. Differential diagnoses are the what ifs, or what could it be. So with the symptoms that this patient is experiencing, formulate a list in your head of what you think it could be. And we're going to look to see if you're right down the road. All right. Subjective continues, and this is medications. She takes oral contraceptives, no allergies, no surgery. But if she had had surgery, you would list them all here. Family history, you want to include family history for at least 2 first-degree relatives. We have father and mother here. She has contraceptive use and condoms, her last period. She lives in an apartment alone with her dog. She does not use tobacco or drugs. She socially drinks alcohol, but not very much. She's single, employed. She works as a waitress. She's heterosexual, and she's currently sexually active with her boyfriend. I would add in here, if I were doing a complete examination of this patient, I would ask, how many are you in a monogamous relationship? You and your partner are both monogamous, very important. How many sexual partners do you have in a year? When was your last screening for sexually transmitted infections? Super important. And I'll tell you, at the clinic that I'm at now, I must get at least 5 patients that come in a day for STI screening. And many of them, they have no symptoms. They don't have any, they don't know that they've had a partner who is has an STI. They're just coming in to get screened because they want to know, or they're one was about to start a new relationship, things like that, which I think is very, very good. Review of systems continues, and you're going to review all of the systems. Remember, there are 10 systems. You need to assess all of them. This is what the patient is telling you, okay? Remember, all of the subjective part is under S for SOAP. SOAP, no. SOAP, S stands for subjective. What the patient tells you. No fever, weight changes, denies itching, all the HEENT, and you can see that we have highlighted, or we have bolded the positives, right? Cardiac, that's, oops. Oh, well, everything else on there was negative. Now we are about to go into the objective piece. Objective is what you can see. We're done with what the patient tells us. It's what you see. And we're going to start with vital signs. Now, and the patient's position should be listed in here. So 110/66, that's great. If they have an elevated blood pressure, it should be retaken, not immediately. I always tell my medical assistants to have the patient sitting in a chair with their feet on the floor, legs not crossed, and that the arm is at the level of the heart when you take it. Otherwise, you're not going to get an accurate blood pressure. Also, the cuff needs to be the right size. I've had so many medical assistants take blood pressures with small cuffs, and then they wonder why they've got elevated blood pressure. I come in and take it, and it's normal. So nowadays, just about everybody is using the electronic blood pressure cuffs, but if you get 2 elevated blood pressures, then they need to take it manually, and then we need to assess whether or not we need to intervene or not. All right, so the rest of the vital signs here, we've got height and weight, BMI. If we've got a pediatric patient, and you'll learn this more later, you do it in percentiles because this number isn't going to tell us much. Pain and the oxygenation. The physical exam. And so we have a pleasant 26-year-old female, well-nourished. She's clean, well-groomed. We're going to talk about her nails, her head, her eyes. ENT, which is the most important piece because that's where her chief complaint is, right? And everything that's positive is bolded here. Cardiovascular, respiratory, I missed neck, musculoskeletal, GI, neurologic, and psychiatric. Now, this seems like a lot, right? And it is. As you progress, I don't document like this on all of my patients. I do focus notes. But as a new student, you will be writing very detailed SOAP notes. As you progress, you may not be expected to do these complete SOAP notes. You may be doing more focus notes. What is a focus note? A focus note, I'm only going to ask about symptoms that presents them to the clinic. So if you're coming in for a sore throat, I'm not going to assess your eyes unless there's something going on with your eyes. Or I'm not going to assess your GI tract unless there's something going on with your GI tract. So a focus note really focuses on the chief complaint and the HPI. But at this point, I want you to focus on very detailed notes. Now here we go, our principal diagnosis. The principal diagnosis is the one that we think it is. So it's the number 1 on the top of our list. And so we believe that this is temporomandibular joint disease, or TMJ. And TMJ syndrome is shared for a term used for disorders that affect the temporal mandibular joint. And then we've got some information here on TMJ. It can cause referred pain, ear pain, tooth pain, headache pain, can do a lot. In adults, ear pain is typically due to that referred pain. And she has reported that chewing and clenching her teeth made these symptoms worse. I would have bolded the things that are positive, but that's okay. Here's a differential diagnosis, one of our what could it be's, and this is number 2, a dental infection. And then we have to list why we think it could be, and then we also have to list why we don't think it is. Okay, so pain is made worse with chewing. She has that. It can cause referred pain. But dental infection is not considered because there's no evidence on physical exam that she's suffering from a dental infection. I think it would also be very important in here to note, I've got to fix this. It went too far over. It didn't look like that when I created it. Oh, well. It's important to identify, does she go to the dentist? Does she have regular dental hygiene? So I would add that to the subjective piece. So here's our number 2 differential. Number 3, subacute sinusitis. This is an inflammation of the sinuses, and it can last 4 weeks to 3 months. So, Here's another one, trigeminal neuralgia. This is a bad one. It's very painful, and this pain, it's like an electric shock. But it's not considered because she doesn't report the pain as sharp or shooting. It's more dull and aching, and it only lasts for a few seconds or a few minutes. So we're going to rule this one out. What's our plan? Well, if we know, we're going to just do what we know. If not, we're going to ensure that we're treating her appropriately. The appropriate treatment plan for this is nonsteroidal anti-inflammatories, and you just learned all about this. So we're going to prescribe naproxen 500 milligrams by mouth twice a day as needed for pain. And we're going to prescribe it for 10 days. I want you to also put in the cost of this. Now, remember, naproxen, you can get over the counter now, so I would look to see which is cheapest. Sometimes prescriptions are still cheaper if you can do it. I've ordered naproxen before by prescription, and you can still order it by prescription. Some of them you can't, like Flonase. Nope. I know. Oh, what the heck is it? Is it Rhinocort or something like that? There is a nasal steroid that still is a prescription that I can order because I want to try to save the patient as much money as possible. But these medications becoming over-the-counter drugs are good in many ways, but they also can be bad because they're expensive, especially when they first come out. They're expensive, and it may be cheaper for the patient, especially if they have Medicaid, to get them as a prescription. All right, patient education, always important. They need to take the medication as directed. It can cause GI upsets, go to watch for that. Take it with food and sit up for 20 minutes. And you've got to be on the lookout for GI bleeding. If you get severe pain, vomiting blood, rectal bleeding, stop the medicine and go to the emergency department. Don't take aspirin, alcohol, or other GI irritants. Report any dark tarry stools. Non-pharmacological treatment. These are always important to list as well if you are using any of them. A soft diet. Avoid foods that are hard, like corn on the cob, apples, hard vegetables, and steak. Apply heat to that area 4 to 6 times a day. Ice packs can be used for acute pain and muscle spasm. Reduce stress. Disengage her teeth by keeping her lips together and her teeth apart. Practice range of motion. Cognitive behavioral therapy and biofeedback have been found to help people with this. So here we have some more. The diagnosis is typically made by history and physical exam. Imaging isn't warranted unless you need to rule out and other conservative treatment fails. So if we had this patient and we were treating her for a couple of months and there was no improvement, then we may want to do imaging. So the CDC recommends primary prevention, annual flu shot, make sure the patient is up to date on their immunizations, talk about exercise, BMI, sunscreen, and a seatbelt. So these are things we talk about. Now, I bring it into our conversation. I don't sit there and say, all right, you need to get a flu shot every year because the CDC says that you need to. When are you going to get it? I just say, as I'm doing my examination, I say, are your immunizations up to date? Yes. Did you get a flu shot this year? And, how much do you exercise? None. Okay. Make sure you're using sunscreen when you get outside and that you're wearing your seatbelt. It's getting hot out now. And all the motorcycles are out. So you want to be careful. So that's how I introduce these things. I'm not sitting down reading from a list. That is a dissatisfier for your patient. All right, some more. When was your last mammogram? And cervical cancer screening now, if you have normal ones, only every 3 years. Depression screening if necessary. Have you ever suffered from depression? And then again, we talked about this before. I would introduce this when I was talking to them about their sexually transmitted infections. I also would talk about the breasts and the PAPs when I was doing that part of the history too. So you can do some of that secondary. You don't have to do it now. I would do it when I was doing the history part. It just makes more sense to me. Follow up. The patient should return to the office in 2 weeks. So make an appointment with her dentist to rule out any dental infection and also teeth grinding. She may need to wear one of those things in your mouth when you sleep at night. We gave her a pamphlet, range of motion exercises, and your facility may have a whole bunch of them, but they may not. You can find a ton online. Just make sure that you are using evidence-based and not using um, some kind of a for-profit or spam place. Um, if you are looking for resources, it's always good to go to professional organizations where you can find those resources for patient education. In fact, I'm going to look for some for you guys. And then here are the references for this presentation. I certainly hope that this was helpful to you. And if you, as always, if you have any questions or concerns, give me a call, an email, a text, and I would be more than happy to help you. Have a good rest of your day. Dr. D signing off.